You are listening to the Horse Radio Network, part of the Equine Network family.
You're listening to the Stable Management Podcast, where we discuss the barn management topics that you're passionate about.
Hi, everyone, and welcome to the Stable Management Podcast. Our goal is to bring you a real-world look into the parts of horse farm management that you love or hate most, such as stall bedding, farm equipment, and pasture maintenance. During each bi-monthly episode, we'll be joined by an expert guest who shares their experiences with and perspectives on an important stable management topic. This podcast is brought to you by Equithrive. Breeding places a unique and time-sensitive demand on the mare's body. Following breeding, a healthy uterine immune response and timely return to balance are essential for creating an optimal environment for conception and early pregnancy. University studies show Equithrive mare pellets support post-breeding uterine immune balance and inflammatory resolution during the most critical stages of the breeding cycle. Do you have a problem mare? Learn more about the science behind Equithrive mare pellets by clicking the link in the show notes or visit equithrive.com. I'm your host, Hailey Pfeffer, and my guest today is Dr. Carleigh Fedorka from Colorado State University. Thank you so much for joining me today.
Thank you for having me.
So our topic today is one that many breeding farm managers are probably currently dealing with, and that's managing common broodmare problems. I think the one thing that I'm hoping to remind everyone of is that getting ahead of these is ideal. So could you just start by telling us what the most common health or management problems that you see in these broodmares are, and which ones might catch our owners or barn managers off guard the most?
Yeah, so that's a great question. A study actually came out about 10 years ago that actually surveyed veterinarians to see what they were seeing the most. And it was reported that the number one problem is a disease known as endometritis, which is just inflammation of the uterus. When I was a farm manager, I called those mares dirty. I know a lot of people will say that they have delayed uterine clearance, but a whole summary of it would just be inflammation of that inner lining of the uterus. And this is a huge problem. It affects probably 20 to 25% of mares, although it was reported right around 15%. And it can lead to things like subfertility, early embryonic loss, or just the financial requirement of breeding mares over and over and over and not getting a viable pregnancy.
Yeah, so when we're managing these brood mares, either while we're trying to get them pregnant or during early pregnancy, what warning signs should we be aware of that there might be an issue with this mare, either to get her pregnant or a problem with that early pregnancy?
So there's some common kind of predisposing factors to mares having this problem. One of the easiest things that farm managers can do before they even send their mare to the vet is just lift up their tail and check what we call the perineal conformation. So that is how those vulvar lips sit beneath the rectum. And if you see that the rectum is really sunken in, almost as if it's being pulled into that abdominal cavity, and then there's almost a tilt to that perineum, that mare's probably going to have a problem. That's a really hallmark thing that we see with these mares that struggle to clear fluid from their uterus. But there's a couple of other things that we can't really change, things like age. The older the mare is, the more common this problem is. If mares have had, 7 or 8 foals, those broad ligaments stretch down and that uterus sits quite a bit lower in the abdomen than a, 3-year-old maiden mare. So all of those are predisposing factors. And then there's a couple of new ones that we're just learning about now. So we just published a study that showed that our mares that have PPID or equine Cushing's, they are more likely to have inflammation in their uterus. It's also been long suspected that mares that have equine metabolic syndrome have inflammation in their uterus. So it's multimodal. There's a ton of different things that contribute to it. And there's some things that we can know ahead of time. And then there's also just the kind of normal, healthy 8-year-old mare that looks great, doesn't have any of those diseases or disorders, and you breed her and she just fills with fluid and it doesn't go away. So there's plenty of what I call the sleeper mares that don't have any of those predisposing factors, and they still struggle with this disease too.
So probably the one thing that I do know about equine reproduction is that you need to be proactive when it comes to these problems. So could you tell us how these barn managers could reduce the risk of these problems or just address them early enough to hopefully make it so that their mare can have a successful pregnancy?
Yeah, so one of the biggest things that any breeder can do to get ahead of problems such as endometritis, or we could list, a myriad of other problems, placentitis and early embryonic loss and low libido and all of these things, is just to align themselves with a really good veterinarian. We have a specialty in reproduction. It's called being a theriogenologist or being boarded for the diplomacy of the American College of Theriogenology. And that means something. That means that those people earned those stripes, and they are the people that are the most well-versed to handle what we call the problem mare. And again, most mares aren't a problem mare. Like I said, probably 25% of mares are going to have this problem, which means that 80% of mares can probably be bred by a regular, ambulatory practitioner. They're easy to get pregnant, easy to settle. But with this subset of mares, you really do want that specialist on your team. And then doing a nice breeding soundness exam or a pre-breeding season workup is so, so, so important. So we commonly say that we will do an endometrial culture on these mares, which is going to look for bacteria. But like I said, this disease isn't always caused by bacteria. It can be caused by just about anything that is foreign to the body. So this disease can be caused by semen. This disease can be caused by saline. So having a culture alongside a cytology, which is going to look for white blood cells in the uterus, is a really good way to start the breeding season. Getting a really thorough rectal ultrasound done and making sure that that mare doesn't have any pre-existing condition. She doesn't have any luminal fluid or, being able to record if she has cysts and where they are. And then also getting a good visual of her ovaries and making sure that they look like what they should for the time of the year and the time of her season. So if we do that pre-breeding season scan and diagnostics in January, and that mare hasn't been under lights, her reproductive tract is going to look very different than if we're doing that pre-breeding season scan now, where she should be coming out of what we call transition, or kind of that segue between winter anestrus and summer seasonality. And her ovaries and her uterus and her cervix are all going to look and feel very different. But having a good veterinarian that you trust to do all of those things and report back to you is just really, really, really essential.
So from a management standpoint, something that we often get questions about is feeding brood mares. Do you see any common nutritional mistakes that people might make with these mares? And are there any ways that the barn managers can support their mares' reproductive health through nutrition or supplements?
That is a really great question, and something that is coming up at the forefront of many conversations when we're discussing reproduction. Because while we don't want our mares to be emaciated by any means, we also don't want them to be obese. And having them on what we say an increasing plane of nutrition as they head into the breeding season is the best way to feed them. So we want them more so at that BCS of 4 before breeding season starts, so that we can kind of plump them up as we are starting to breed them and monitor for pregnancy. We don't want to see that mare come in at a BCS of 7 and put a grazing muzzle on and try to restrict her nutrition, because embryonic development and then more so fetal development requires a ton of nutrients. It requires a good level of protein. So we don't want to be starving our mares while we're trying to grow that fetus. With that being said, though, we don't know a ton about what the perfect diet is, because every mare is so uniquely individual. So say our mare does have equine metabolic syndrome and she's insulin dysregulated, she's going to be fed something very different than our 4-year-old thoroughbred mare that's coming off the racetrack, ran her last race in February, and we're breeding her in May. So it's very much an individual thing. And I do strongly recommend consulting a nutritionist to make a guided plan for your individual mare. There's only a couple of supplements out on the market that have any data to prove that they're helpful for breeding the mare. The first is L-carnitine. And L-carnitine is a protein or an amino acid that is used in a lot of supplements. I know that Platinum Performance funded a study that found that it was quite impactful in those equine metabolic mares. So in the mares that are obese, that are insulin dysregulated, that L-carnitine improved oocyte quality and helped those mares have a successful aspiration for, say, ICSI. The other one that was just recently published actually from our group is resveratrol. And resveratrol is another protein. It's actually found in grapes, and it's why doctors say that one glass of red wine is really good for your heart health, because it's really anti-inflammatory and it's also a really good antioxidant. So we just finished a study. It got published a couple of months ago where we took these mares that had endometritis, and we fed them resveratrol in a supplement. And we were able to decrease all of that inflammation that I just described to you as being so problematic. So if I was a breeder, I would avoid supplements that don't have data that's published behind them and reach for one of those two, whether it is L-carnitine or resveratrol.
Yeah, I think that's a common theme on this podcast, is to always choose supplements wisely and take a good look at the research before you choose one.
For sure. And also take a stock of what your diet for your horse is lacking. So make sure you're getting your hay tested. Make sure you're working with a nutritionist and looking at their diet, feeding the directions on that bag. That's become a common problem that I've noticed, where people are feeding senior feed to their horses, but they're giving 3 pounds a day, once a day. And if you have a 1,200-pound horse, that's not even, meeting their minimal daily requirements. And we need to start there. These horses that we're trying to get pregnant need to have their essential vitamins and minerals. So if you're in a location that's lacking vitamin E, make sure that you're supplementing with vitamin E, but more so make sure that you're working with a veterinarian and a nutritionist to know how much you need to supplement. And then once your animals are on that minimum requirement for vitamins and minerals, then you can start modulating other things. But having that essential basic diet is so important.
Definitely. I'm glad you brought that up too, because that's something else that we also get questions about, is the essential vitamins and minerals. I think that's a really common misunderstanding. This podcast is brought to you by Equithrive. Breeding places a unique and time-sensitive demand on the mare's body. Following breeding, a healthy uterine immune response and timely return to balance are essential for creating an optimal environment for conception and early pregnancy. University studies show Equithrive mare pellets support post-breeding uterine immune balance and inflammatory resolution during the most critical stages of the breeding cycle. Do you have a problem mare? Learn more about the science behind Equithrive mare pellets by clicking the link in the show notes or visit equithrive.com. So how should managers approach the mares who might have a history of reproductive problems that you've mentioned before? This could range from infections to pregnancy loss, especially when planning future breedings.
I think that's a fantastic question. I am married to a broodmare manager. He was a broodmare manager in Kentucky for almost 20 years. And my biggest suggestion to him every fall was to do your workup in the fall. So say you have this problem mare and you maybe bred her 4 or 5 cycles and she did everything incorrectly, whether that was pooling with fluid after you bred her, whether that was not ovulating like you thought she would, or maybe she did everything right and just did not get a successful embryo or a successful pregnancy. A lot of the times as farm managers, we leave that breeding season pretty frustrated. We shake our head, we throw her in a, huge 100-acre field with a ton of grass and trim her feet, but we just leave her alone until the following breeding season. And then that frustration just recycles. And one of the ways that we can get ahead of that is not just throwing them back into the field, both either, dirty or more so without a clear diagnosis and treatment plan. And so I would always tell my husband, pull those barren mares back out in late September before they go into anestrus and do your workup. And in that case, your workup might have a couple of other things. So we've already mentioned culture and cytology. Those are both really great basic diagnostic tools for us. But another level above that would be what we call the low volume lavage. So the issue with culture and cytology is that you're literally taking a Q-tip and you're sampling a single part of the uterus. So it doesn't give the most representative image of that uterus. And by doing what we call the low volume lavage, we can put, say, 500 mils or 1,000 mils of saline or lactated ringers into the uterus, spread it around, and kind of we will manually massage the uterus via the rectum. And then that way, when we pull that out of the uterus, we have a bit more of a broad representation of what's going on in that uterus. And it's quite common that the site of inflammation or infection isn't right dead center in that uterine body. It could be up in the horns or even local to the cervix. So by doing that low volume lavage, we get a much better picture of that. And then the other thing we can do that is not as commonly done out in the field, but we definitely do it here at our teaching hospitals and in academia, is our endometrial biopsies. So we can actually take a sample of that tissue in the uterus and get a really good idea of what we're dealing with. And when we send those samples out to a pathologist, they tend to come back with what we call the Kenny and Doig scoring system. So that's going to be a scoring system that goes 1, 2A, 2B, 3. And our grade 1 mares have a 90% chance of carrying a pregnancy. Our grade 2A mares have a 50 to 90% chance. Our grade 2B have a 10 to 50% chance. And our grade 3 have less than a 10% chance. But more importantly than those risks that we're looking at is actually trying to figure out why those mares have a decreasing chance of pregnancy. Because we can see on that sample, if it's simply just inflammation, if there's just a ton of immune cells in that tissue, that's actually fairly straightforward to treat. We can use things like anti-inflammatories. We can use things like hydrogen peroxide or DMSO. But if there's fibrosis, which is just scar tissue within the uterus, which is what we usually see with our grade 3 biopsies, there's really little that we can do to fix that fibrosis. And so that's giving us a better picture of, okay, can we come up with a treatment plan, and what is our success rate for that treatment plan when we use it? And I really like that, because then I at least know what I'm heading into the next season and where, the team, the farm manager, the owner, and the veterinarian can all come together and kind of go forth with a plan for that mare.
So this might be a controversial question, because I know how horse people feel about new technology and tools, but would you say that there's any practices or tools that our broodmare managers are underutilizing right now when it comes to preparing their mares for breeding?
That's $1 million question. There's a variety. So first and foremost, if you're not breeding thoroughbreds and your mare has this problem, a simple solution is that you just put her into an embryo transfer or an ICSI program. So, and more so, we're just now getting IVF, in vitro fertilization, to be clinically applicable. So if your mare truly has a uterus that's not healthy and not happy, we can simply breed her and flush out that uterus and have another mare carry it. Or we can totally bypass the uterus, aspirate oocytes from her ovaries, and then make an embryo in a petri dish. So that's not underutilized, but it's an obvious plan if your breed registry allows it. There's a couple of interesting therapies that are out currently, and some of them have really taken hold and, had a lot of success. And some practitioners are still a little hesitant to do many of them. One of them is ozone. So we can actually put oxygen or ozone into the uterus. Instead of it being O2, which is oxygen, it's O3. And that has been found to help eliminate bacteria and reduce inflammation. We also have the controversial treatment of kerosene, which is being used. I don't think it's underused, but I do think that it can be misused. So kerosene is one of the treatments, one of the only treatments that we know to help reduce fibrosis. So if you do that biopsy of that mare and she does have a ton of fibrosis in her endometrium, it would definitely be something that could be reached for. And I will say it always makes people gasp when we say put kerosene in the uterus. But we are actually working on a study here at CSU that is looking into the safety and the welfare behind that treatment. So we're not just looking at its improvement on the uterus, but do we actually cause pain and discomfort and stress in the mares that we administer it to? And so far with our preliminary data, we don't. The mare's heart rate stays normal, her cortisol levels stay normal. We're also working on like a behavioral ethogram to see if like her pain score that way stays normal. So stay tuned to that coming out. But I do think that it's not as terrifying as many people think it is. We just need a ton more data to show when and how to use it and when it's most effectively used. And then a whole class of treatments that I call immunomodulators or biologics. And I really, really, really encourage veterinarians to reach for them. We have things like platelet-rich plasma, PRP, or Mycobacterium cell wall fraction, MCWF. So MCWF, we commonly refer to it as the drug settle. Both of those treatments have been found to not only reduce inflammation, but to also kill bacteria. So we have options that can be used in place of antimicrobials. And that's just a huge passion project of mine because we misuse antimicrobials in reproduction pretty commonly. So I think that that's the sales pitch. If we can all be better stewards of antimicrobial resistance, that would be huge. So again, just reaching for one of those biologics in place of maybe infusing with Timentin or penicillin.
I will fully admit, as someone who knows very little about breeding and reproduction in the horse world, I was one of those people who gasped at first when I heard about kerosene. But now that I'm learning more, I'm less afraid of it. But I can understand why people might be a little scared when they first hear about it.
Yeah, I also gasped when I first heard about kerosene. I had never used it as a farm manager, and I heard about it at the first conference I went to. And a couple of things that I will give, not to be the advocate for kerosene, but as the scientist, why I can wrap my mind around it. First and foremost, I think that if we put it in a pretty pink bottle and labeled it Immunicare, nobody would question it. We put a lot of stuff on our horses that is incredibly dangerous. The one I always bring up is furacin. Like we read the back of the jar of furacin and it says it causes ovarian cancer in rats and mice. And yet we slather it on our mare's legs. And we also very commonly use it without nitrile gloves. So we're endangering ourselves and our horses. The other thing is, I don't know about you, but I hated when my mom poured hydrogen peroxide on a cut. And yet nobody has an issue with putting hydrogen peroxide in an inflamed uterus. So I do think that kerosene has gotten a bad reputation with really little rationale for why. And yet we utilize a ton of stuff that perhaps we should look a little bit more analytically into, and we just let those ones slide. So it does bum me out in that way. And I do think that there is a use for kerosene in clinical practice. It sure as heck is not something I'm reaching for in my first line of treatments. But for sure, if you have that mare that failed to get pregnant in 5 cycles and your vet and your farm manager did their job, right? That mare was teased. She was ultrasounded. We knew she was an estrus. She ovulated within 24 hours of being bred. And then she just pulled fluid and no other treatment worked. I sure as heck would tell you that kerosene would be on my treatment list that coming September.
So my final question for you today is maybe a tricky one because it's if you could give these broodmare managers just one piece of advice to help prevent some of these problems, what would it be?
I stand by my previous answer that a good veterinarian is worth their weight in gold. I have too often seen that either breeders are trying to do the mare work themselves, which is not illegal by any means. If you own the animal, you can do the ultrasounds and the palpations, but having an education and an arsenal of knowledge behind you is incredibly impactful. We also joke that one of the greatest causes of infertility is mares not being bred in estrus. So just having that veterinarian that truly knows what they're looking for, truly can help you predict when that mare is going to ovulate, get semen into that mare at the right time, and then be able to monitor those mares and help them after you've bred them, whether that's with just simple oxytocin or maybe a uterine lavage, or maybe it's as advanced as platelet-rich plasma or one of these crazy mucolytics. Those are all things that the well-practiced veterinarian, and hopefully more so that theriogenologist, knows like the back of their hand. Whereas the less experienced vet, or the one that doesn't do a ton of reproductive practice, or that lay person, just doesn't have that full arsenal behind them. And this is coming from somebody who is not a veterinarian, right? I have my doctorate in veterinary sciences with a focus on this specific problem. But I've just seen it time and time again where one of the biggest issues is not having that trustworthy vet team behind you. And that can make the difference between getting a pregnancy and not.
That's all the time we have for today, but that was a great piece of advice, and it's been awesome talking with you today. Thank you so much for joining me.
Thank you so much for having me.
And thank you all for listening today. Please remember to like this podcast, subscribe, leave a review, and recommend the Stable Management Podcast to a friend.